The medical realm is constantly growing and evolving. With the advent of technology and inventions such as the internet, all this research is available at our fingertips. There are numerous databases crediting or discrediting various aspects of medicine. Long gone are the days where the doctor is the sole wielder of knowledge. Much like how Martin Luther gave access to the Bible to millions for their own interpretation, the internet has given people knowledge and the control to make decisions for their own bodies. Empowered with misleading information, patients can be misinformed and not willing to listen or even consider the doctor's advice. How do we tackle this?
In the Checklist Manifesto, Atul Gawande outlines that the field of medicine has drawn inspiration from other specialties such as construction and aviation to improve patient safety and enhance medical practices. Existing protocols such as the GMC and NICE guidelines outline effective communication practices. But are there any better techniques and any ways to enhance our communication system? Our journey to find this answer takes us to Mayfair in the borough of Westminster. Mayfair is known for its luxurious residential properties, upmarket shops, restaurants and modern hotels. There are numerous antique shops in Mayfair, some housing authentic antiques and others selling impressive duplications of authentic products.
Beside Bond Street Station, nestled in a terracotta building in London's West End, is Gray's Antiques Centre, a labyrinth of corridors spanning 2 buildings with over 200 dealers selling everything from ancient artifacts dating 40 BC up to 20th century collectibles. Gray's is the epicenter of the art and antique dealing world. We spoke to some antique dealers to find out or uncover how they tackle queries regarding the authenticity of their products and what techniques they use to address them.
We're here today to talk about the manifestations of medicine along with antique dealing. And we have our patient here today who's been in the antique business for a really long time, and we're really going to be exploring how this kind of relates to medicine and how we transition between the 2 fields. It seems like a very nuanced field, and obviously there's a lot of trust, I guess, between the buyer and the seller, because you're dealing with such an important artifact. So your customers, much like the average patient, they must be quite concerned that you've provided them with, I suppose, the correct information. How do you reassure them of this?
Yeah, that's very important. It is very important to sell this item with lots of informations. And if you give them a sort of true meaning or information, then they come back to you. And unfortunately, lots of people deal in the fake antiques because it's much easier, and if you manage to sell more money. But we hate that. Actually, we hate that. That's why we call ourselves La Verite. Verite means truth, or straightforward, or honesty, isn't it? That's the most important thing for us, or genuine. It is very difficult, but I think honesty is the most important thing. So I said, well, in my opinion, and after 25, 30 years experience, I feel that this is not right. I just tell them. But how to tell them, you have to be diplomatic. I always put myself into their shoes, how they feel. So I don't upset them too much, because I don't want to be upset by anybody. So I choose word carefully and try to show the evidence. That's why this is a fake. Anyway, if you spend the time and talk to them honestly, then they will understand, and they will come back.
Well, I think your point about honesty is very, very relevant to our field.
I think so. That's the only way, I think.
Yeah, absolutely. Is there a certain method or way you do communicate with those who are maybe a bit more resistant to trusting you?
I always say that, if any problem, you can always bring it back. You really have to be sort of genuine and at it with your full intention. And reputation is very important for us, because one wrong information ruins your business. I just say that, well, if you're not satisfied or if you find something wrong, you can bring it back. So she said, you're very honest, so she keeps coming back now, because we just tell the price, tell the truth, and we sort of investigate. Also, I know what they are worried about. So just understanding, isn't it? Yeah.
I suppose what I really admire about you and the way you deal with things is the rapport you build with your customers. Because having this kind of level of trust and admitting when you weren't wrong, but there was something that the customer wasn't satisfied with, and you kind of dealt with that rather than refusing.
Exactly.
Which is the easy option.
Oh yeah, very easy.
And that's what most people do. And I think being at Mayfair and being with the GP, we've had the privilege to kind of see how doctors also build this rapport with patients. And much like how you kind of understand your customers' concerns, we're kind of here to understand the patient's concerns.
Yes.
And now that we have the mass production of so many items, what do you think keeps the customers faithful to you, and what do you think makes them come back to follow your advice? Because the reason this question is very relevant is that because obviously, there's a mass amount of information out there that patients can access. So how can we have that loyalty to the doctor, and not just the doctor, but to the medical profession, to know that, we're here to help them? So how do you think this trust and cooperation can be built?
Well, they don't give you much time, and they just treat you like right next, patient A, patient B. I never opened up to them. But when I came here, Dr. Nazir, I came past, and then of course, we didn't know each other, but he was there for you. Maybe 2 minutes, 5 minutes, but his time is on me, which I felt very comfortable with. Then I really felt that, thank God he's listening to me.
What really kind of kept the loyalty between you and Dr. Nazir? The time he dedicated to you.
Yes, he did. Yeah.
And do you find that similar in your business, that when you really dedicate your time to a buyer
in
explaining everything, that they are more likely to come back?
Oh yes, of course, because they want to be treated right.
One thing we've noticed here is that it's really a village. But we go out and everyone knows the doctor.
Hi doctor, hi doctor.
We have a very good relationship with him because he's taken the time and the years to build these relations with the patients. It's an interesting contrast to the traditional medical center, I believe.
So everything Dr. Nazir says, I trust him. So I say, yes, okay, time is most precious thing, and then time you give to patient or my customer, it's always come back to you.
Absolutely. So when the patients do come in with any issue, with kind of a lack of trust, what tends to be their main concern, and how do you deal with that? You explored that a bit, but maybe there's anything you'd like to add?
If problem arise, we always talk to each other. My husband and I talk to each other. Then we explain to them why this is a problem. Again, back to the sort of time thing, isn't it? We give our time to explain to them what is the problem.
Just for our last question, as humans, we all make mistakes. And have you ever made a mistake in selling an item? And how does this affect the customer's kind of reliance and opinion of you and your business?
Yeah, be honest with them, because we have made mistakes. So we thought it's wonderful thing. So we bought, came back, and we saw there happened to be a reproduction. Then customer was furious. I trusted you, and you sold it to me a reproduction. I lost my face, because my customer trusts me, and all this big thing went on. So only thing I could do is, straight back to this dealer, said, I'm so sorry, I'm not the god, I made a mistake, I'm so sorry. Be honest with them, and we try to investigate more about it, why it's happened, and we try to get to the source.
I guess choosing to be genuine, because that's what your principles are, and that's so nice to you. And the reason I asked that was more because, like we said, doctors are very overstretched and they're bound to make a mistake in their day-to-day practice and while treating patients. And I suppose what we've kind of learned from you, as well as from being here, is that the best way to deal with that is really be honest with the patient and tell them that, yes, we did make a mistake, but this is why. And that's why I think it's really important to kind of track these mistakes and see how we can improve from them. Thank you for talking to us. It was very insightful to learn about your business. And I think it's always interesting to see how we can learn from different fields to improve our own. Obviously, there's a lot of, differences, but there's always a lot of similarities and things to learn from as well.
Well, trust is very important. Yeah.
I think that's been the foundation of our conversation today.
I think so, yeah.
Thank you so much, and I think we'll wrap up now.
Dedication and attention are qualities necessary in every profession. Often this is difficult to achieve with the time constraints and other limitations placed on us as medical professionals. However, we have learnt that these qualities, although easy to forego, are ones that not only help establish rapport, but also lay down the basis for sustaining the long-term relations and trust necessary for patient care. The antique sellers, despite being in the competitive business world, have flourished by ensuring their honesty with their clients, something that we ought to learn from as health professionals. These soft skills, which may be often overlooked, penetrate the foundation of most professions, and are the ingredients we can use to begin dispelling the myths and mysteries of medicine.